It's really very lovely to be here. As Joel explained, NYCOSH really was a collective initiative of really a large number of people, 20, 30 people got together on a regular basis. A surprisingly large number are still here working in occupational, here in this room. I think, I know I'm just blown away when I see NYCOSH, which started out as a volunteer group, now has this very impressive staff and does such amazing work. And it's very heartwarming and it just makes me feel very proud. I'm glad I could be part of that process. And certainly I learned a tremendous amount in that process. And when we talk about the board and the arguments we had over how the board should be structured, how it should be composed, what rights should be, we went through all of that and really had to argue out a lot of very important points. And in that process, really put together a very strong organization. And it's a great thing. Now, of course, when we were doing that, the people we looked to for help and for guidance and for inspiration were, among others, but very importantly, Charlie Richardson and Nancy Lesson. Charlie, who was at Philipposh, and Nancy, who was at NYCOSH. So, I actually don't like to be called a dinosaur. But the people who came before us are Nancy and Charlie. They're the ones who we should really be honoring. I won't call them that. And I think OSHA is doing a lot right now, but it's not at all because I'm in the lead of it. I know OSHA's an amazing organization, and it's a wonderful thing for me to be sort of catapulted to the front of a large group and make it look like I've been leading them for a long time. I'm only there for 5 months. And the true story of OSHA is filled with very dedicated professionals, especially in the field, who work very hard during whatever the administration is to protect worker rights. And they got a lot less publicity, and certainly policies didn't change or got worse, but during those years, which we think of as years that OSHA did badly, there were still a tremendous number of people working very hard, doing good things. And there are 4 of them in this room, and I want them to stand up so you can meet them. Robert Pulak is the Regional Administrator for Region 2, covering New York, New Jersey, Puerto Rico, and Virgin Islands. KG is the Area Director for Queens, Brooklyn, and Manhattan. Diana Cortez, she snuck out, is the Area Director for the Bronx, Westchester, and Rockland County. And Laura Kenny, who's our labor liaison. And I still consider myself a New Yorker, are very fortunate that this is sort of part of the leadership team from OSHA in this area, because it really is a remarkable and really unsurpassed team in the country. And they do great work. I want to talk very, very briefly about 2 challenges. I don't need to repeat all the hazards facing workers, the terrible toll that they're paying. But OSHA faces some challenges, and we really need your help. One new direction that we've announced is essentially turning around the basic model. Right now, the way the OSHA law is written, the way OSHA's always worked, is we expect employers to meet OSHA standards. And it's clear to me that that's not enough. We can't issue a standard on every hazard. We don't have enough inspectors to be in every workplace, so we can't have the model that sort of catch me if you can, that we get out to workplaces. If we find hazards, we cite the employer, but that's not enough. It's not going to reduce the terrible toll that's out there. So we've started the process to have a requirement that every employer have a safety and health plan, essentially an injury and illness prevention program, that says it's the responsibility of employers to very simply find the hazards in their workplace and fix them, and involve workers in that process. And so it's really turning things upside down, and we're starting that process. We're having a series of meetings around the country. We're looking for input. We're looking for support. We want to make sure it works. So I hope you can get involved in that and give us your thoughts. We have our first stakeholder meeting June 3rd in New Brunswick. And come out and talk to us and be involved in that. We're very eager to hear what you think of that. The second challenge which we face, and we all face this, is dealing with the safety and health hazards facing migrant workers and non-English speaking workers in the United States. And it clearly is the biggest safety and health challenge we face, and the most significant one. The worst jobs, the lowest paying jobs, are being taken by people who have the least rights. In many cases, they don't know what the hazards are they face. In some cases, they know the hazards, but they know they have no choice, or they think they have no choice. And we have to do better. We have to make sure that their jobs are safe, because if their jobs are safe, if their jobs are not safe, then no one's job is safe. And it's very important. So Secretary Hilda Solis, who's my boss, has focused very much on this, and we're trying very hard to work to move OSHA to work much more closely with not just unions, but also community groups, religious groups, any group that really can reach out to these workers and tell them what their rights are, give them information, help them organize around safety and health. And we need your help, and I know NYCOSH is very much involved in that. And that has to be all of our focus, because we know that the worst jobs are going to these communities, and we really have to address that. So, again, let me thank you very much. I'm really honored and pleased to be here with so many old friends and colleagues, and I hope we can do this again in another 30 years.